Senator Sanders.
Let's talk about big government-run plans. I don't want to shock anybody here and have people dashing out of the room, but the VA is a socialized healthcare system, right, Mr. McCain? Socialized medicine. That's what it is. That's not public insurance. It's socialized.
Not exactly my description, but
okay. And, you know, the VA has its problems. We all know that. But by and large, I think it's fair to say we go home, we talk to our veterans. You know what? They feel pretty good about the VA. They go in there, they're treated. The staff usually is dedicated to them. They're not out busy raising money, charging them money. At least in the state of Vermont, I got to tell you, people want more VA, not less VA. All right, that's socialized medicine in the United States of America. Anybody here want to bring an amendment up to eliminate the VA? I would suggest the chairman accept that amendment. I don't hear too many people. Let's talk about single payer. Well, in the United States, we have a strong single payer system. It's called Medicare. Medicare have its problems? Sure it does. But if anybody wants to go out and compare the attitude of the people of this country toward Medicare, which does not throw people off for pre-existing conditions, doesn't throw you off of the program because you committed the crime of getting sick the previous year, contrast it to how people feel about private health insurance, let's have that debate. And I suspect those of us who want to improve Medicare rather than want to improve or support private health insurance will win that debate. The function of what we're doing here is not to support the private health insurance industry. I know this is a shock. The function of what we're trying to do here is to provide the best quality health care to the American people in the most cost-effective way. In 2007, just to make the point, Gallup poll, 2007, 64% of respondents answered that they thought it was, quote, the responsibility of the federal government to make sure all Americans have health care coverage. 2007, AP, Yahoo poll, 65% of respondents said that, quote, the United States should adopt a universal health insurance program in which everyone is covered under a program like Medicare that is run by the government and financed by taxpayers, end of quote. I think in every gathering in the United States of America, most people think the government should play a strong role in providing health care to people, except in the United States Senate, probably the only institution in America where people think that the private insurance companies should be playing the dominant role. So that's all that I wanted to say. I don't want to get into the details of this debate, but I think it doesn't make a whole lot of sense to continue to defend how wonderful those private insurance companies are and what a great job they're doing. That's not what I hear in Vermont, and that's not what I'm hearing all over America. Should we improve public health in all respects? Of course we can. But I would just conclude by saying our job is not to protect the private health insurance industry. It's to provide quality, cost-effective health care to the American people.
Would the Senator entertain a question?
Sure.
That was an elegant and forceful defense of a single-payer approach, which you've...
Actually, it wasn't, but it's...
Well, I give you credit.
Thank you.
And you've done that, and you made that position clear on a number of occasions. Will you be voting for this bill as it's before us?
I will be voting to get this bill, you know, based on the amendments that are coming forward. But everything being equal, I will vote for this bill to get it out of committee. How I will vote in terms of final passage on the floor is, I most certainly have not yet reached a decision.
Thank you.
Mr. Chairman.
Senator.
Hopefully just to finish up, it makes no sense